Blood pressure is the pressure exerted by the circulating blood upon the walls of blood vessels and is one of the principal vital signs. During each heartbeat, blood pressure varies between a maximum systolic and a minimum diastolic pressure. Blood pressure is usually measured at a person's upper arm, inside of an elbow at the brachial artery, the upper arm's major blood vessel, which carries blood away from the heart. While various factors such as age and gender influence average values, any person of any age can have high or low blood pressure readings. The desirable systolic range is between 90 and 119, and the desirable diastolic range is between 60 and 79. Blood pressure measuring lower than those numbers is called hypotension. Hypotension can cause less blood to flow to the body's organs and is risky because it can cause a person to fall due to dizziness or fainting. Severe hypotension can cause a person to go into shock and can be fatal if not treated immediately. You can take steps to prevent hypotension, such as drinking a lot of fluids to prevent dehydration and getting plenty of sleep. Blood pressure measuring over desirable numbers is called hypertension. Hypertension can induce cardiovascular damage. This can lead to heart attack, stroke, heart failure, and aneurysms. Causes of hypertension include smoking, obesity, lack of physical activity, and stress. Hypertension can be treated with medication, lifestyle change, or a combination of the two. If blood pressure measures over 180 for systolic or over 120 for diastolic, that is called hypertensive crisis or hypertensive emergency and needs to be treated immediately. Call 911. Warning! 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 A call to action from the American Heart Association, the American Society of Hypertension, and the Preventive Cardiovascular Nurses Association recommends that people get a monitor and check their blood pressure regularly at home. Home readings tend to be a better reflection of a person's true blood pressure because they are taken in a familiar setting. Follow these steps to take your blood pressure at home. You can do this yourself or have somebody help you. You'll need a quality stethoscope, an appropriately sized blood pressure cuff, a blood pressure measurement instrument such as an aneroid. Prepare the patient. Make sure the patient is relaxed by allowing 5 minutes before the first reading. Remove excess clothing that might interfere with the BP cuff or constrict blood flow to the arm. Be sure that you and the patient refrain from talking during the reading. Choose the proper BP cuff size. Most measurement errors occur by not taking the time to choose a proper cuff size. Wrap the cuff around the patient's arm and use the index line to determine if the patient's arm circumference falls within the range area. Place the BP cuff on the patient's arm. Position the blood pressure cuff so that the artery marker points to the brachial artery. Next, position the stethoscope. On the same arm as the blood pressure cuff, place the bell of the stethoscope over the brachial artery. Inflate the BP cuff. Begin pumping the cuff bulb as you listen to the pulse sounds. When the BP cuff is inflated enough to stop blood flow, you should hear no sounds through the stethoscope. Slowly deflate the BP cuff. Listen to the systolic reading. The first occurrence of rhythmic sounds heard as blood begins to flow through the artery is the patient's systolic pressure. This may resemble a tapping noise at first. Continue to listen as the BP cuff pressure drops and the sounds fade. Note the gauge reading when the rhythmic sounds stop. This will be the diastolic reading. Double check for accuracy. The AHA recommends taking blood pressure readings from both arms and averaging the readings. If your blood pressure reading is a concern, please consult a physician immediately. But if you eat right and exercise, you'll notice the results in the blood pressure readings and live a healthy life.